Hello everyone, I'm Anas Al Ubaidi, and the title or the topic for this lecture or session is Guide to Obtaining Accurate Patient Histories within the chapter of Review of Medical Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Patient history taking is one of the most critical components of healthcare. This process, conducted at the very beginning of the patient interaction, lays the groundwork for accurate diagnosis and effective treatment planning. A well-documented history provides clinicians or providers with a comprehensive understanding of the patient's current health concerns, past medical conditions, and factors that may influence their overall care. It also serves as a communication tool for all members of the care team, ensuring continuity and clarity throughout the patient's healthcare journey. Beyond its clinical value, patient history taking plays a significant role in building trust between the patient and the healthcare provider or the clinician. When patients feel heard and understood, a stronger therapeutic relationship develops, enhancing the likelihood of engagement with treatment plans and adherence to medical advice. For medical scribes, the ability to record patient histories accurately and efficiently is a critical skill as it directly supports physicians in their clinical decision making process. The responsibilities involved in history taking are complex. Medical scribes must ensure that all details are captured precisely while navigating time constraints, cultural differences, and the need for empathic communication. Objectives: understand the role of patient history in diagnosis, treatment, and communication, learn the key components of comprehensive patient history and their relevance, master proven techniques for effective and empathic history taking, identify common challenges and solutions in gathering patient history, and apply these principles to real world clinical scenarios. Key points: essential components of patient history. Obtaining a complete and structured patient history ensures no critical information is missed. Each component provides valuable insight into a different aspect of the patient's health, contributing to the development of a holistic treatment plan. Patient identification and demographics. Details like name, age, gender, contact information. So, basic demographic information gives context to the clinical picture and aids in communication and record keeping. Example: document the patient's full name, date of birth, and emergency contact to identify the individual uniquely. The importance here: accurate demographics ensure the history is tied to the correct patient, avoiding mix-ups in records or lab results. And here's a diagram on patient history hierarchy. Chief complaint and presenting symptoms. The chief complaint is the patient's main reason for seeking medical care. Associated symptoms provide context to hone in on the potential diagnosis. Details here: primary concern and other related issues. Example: a patient presents with persistent chest pain for 3 days with shortness of breath or dyspnea. The importance of this initial statement often drives the clinician's focus for further history taking and diagnostics. And here is a diagram on breaking down a patient chief complaint. Past medical history, PMH for short. Understanding the patient's previous medical conditions provides insight into predisposing factors or chronic issues. Detail significant illnesses, surgeries, or hospitalizations in the past. Example: not a history of asthma, hypertension, or a prior appendectomy. Importance here: past conditions often have implications for the current complaint or treatment options. And here is a diagram on building a comprehensive patient profile. Family history, FH. Family medical history sheds light on genetic or hereditary conditions that could influence the patient's health. Details here: medical conditions among immediate family members, such as parents and siblings. Example: record a family history of diabetes, cancer, or cardiovascular disease. Importance here: knowing risk factors like familial heart disease allows for early preventive measures. Social history, SH, and lifestyle factors. Social determinants and lifestyle choices can significantly affect health outcomes. Details about occupation, smoking, alcohol use, substance abuse, and exercise habits. Example: a patient reports smoking half a pack of cigarettes per day and working a highly sedentary desk job. Desk job. Importance here: lifestyle habits often contribute to conditions like hypertension, obesity, and lung diseases. Medications and allergies. Detailing medication use and allergies provides a basis for safe treatment planning. Details current medications, prescription, over-the-counter supplements, and any allergic reactions. Example, note that the patient takes metformin for diabetes and has a penicillin allergy. Importance: avoiding allergic reactions and drug interactions is essential for patient safety. Review of systems, ROS. A thorough system-wide survey helps capture additional symptoms that may not have been initially mentioned. Details here questions, structures around different body systems, for example, respiratory, cardiovascular, gastrointestinal. Example, ask about symptoms like fatigue, dizziness, or skin rashes, even if unrelated to the chief complaint. Importance: the ROS, review of systems, or systematic review or systemic review, can reveal patterns or symptoms critical to accurate diagnosis. Techniques for effective history taking. The quality of the patient history largely depends on the healthcare provider's approach during the interaction. Effective communication fosters trust, ensures completeness, and minimizes errors. Open-ended questions, encouraging patients to describe their concerns in their own words, often reveals key insights. Purpose: provides detailed, patient-led accounts of symptoms. Example, what brings you in today, or can you describe the pain in more detail? Active listening, attentive, empathic listening assures the patient feels valued and understood. Purpose here reduces misunderstandings and allows the provider to build rapport. Example, paraphrasing what the patient shares. For example, it sounds like the pain worsens when you exercise. Nonverbal cues. A patient's body language or facial expressions can communicate valuable information. Purpose here highlights aspects of the patient's concerns that they may hesitate to verbalize. Example, a clenched fist might indicate stress or physical discomfort. Cultural sensitivity. Adapt history-taking protocols to align with diverse cultural values and beliefs. Purpose here facilitates trust and avoids alienating patients with different perspectives. Example, respect a patient's reluctance to discuss certain family issues due to cultural norms. Challenges in history taking. History taking is rarely straightforward, with various obstacles affecting the information gathering process. Being prepared for these challenges is key to overcoming them. Ensuring accuracy. Patients may inadvertently omit or misrepresent information. So, example, a patient forgets to mention a medication they use occasionally. Solution: utilize specific follow-up questions and cross-check information when possible. Time constraints. Busy clinics or emergency settings often limit the time available for history taking. Example, a scribe may only have 10 minutes with their physician to complete history notes. Solution: prioritize key questions first, focusing on the chief complaint and any life-threatening factors. Examples of clinical application: detailed history for complex cases. Situation: a patient presents with unexplained weight loss and fatigue. Action: a full review of lifestyle, family, and systemic symptoms leads to identifying hypothyroidism. Comprehensive documentation for chronic conditions. Well, a patient presents with unexplained weight loss and fatigue. A full review of lifestyle, families, and systemic symptoms leads to identifying hypothyroidism. It's most likely with weight loss, hyperthyroidism, high thyroid hormone secretion by the thyroid gland, so hyperthyroidism. However, if it was weight gain and fatigue, unexplained weight gain, then would be hypothyroidism, meaning secretion of the thyroid hormone less than normal, less than the normal range. Comprehensive documentation for chronic conditions. Situation here: a new patient with diabetes, hypertension, and chronic back pain requires detailed notes for effective care. Action: the scribe compiles medications, lifestyle factors, and recent lab results into an organized EHR, electronic health record entry. Summary tables for consolidation. Here we have table on essential components, table on techniques for effective history taking, And here, by mastering the art of obtaining accurate patient histories, advanced medical scribes become integral to effective healthcare delivery, ensuring safety and continuity of care. Here also we have summary tables, table on essential components of patient history, table on techniques for effective history taking, table on challenges in history taking, table on clinical applications of history taking, table on strategies for improvement. Then next we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. Which component of patient history involves documenting previous surgeries and medical conditions? A. Social history. B. Past medical history. C. Family history. Or D. Review of systems. Definitely it's B, as past medical history includes prior illnesses, surgeries, and hospitalizations. Question 2. What is the primary purpose of open-ended questions in history taking? A. To limit patient responses for quick documentation. B. To ensure precise medical terminology is used. C. To encourage patients to describe their symptoms in their own words. Or D. To save time during consultations. The answer is C, as open-ended questions allow patients to share detailed information without restrictions. Question 3. Why is cultural sensitivity important during patient history taking? A. To avoid asking questions about symptoms. B. To respect the patient's beliefs and adapt communication accordingly. C. To minimize the end for documentation. Or D. To standardize the interview process. The answer is B, as recognizing and respecting cultural differences ensures effective communication and builds trust. Question 4. What challenges commonly faced in obtaining comprehensive patient histories? A. Lack of medical training. B. Time constraints. C. Availability of technology. Or D. Over-reliance on healthcare staff. Well, the most accurate or the most proper answer would be B. Time constraints, as time constraints often limit the depth of history taking, requiring prioritization of key questions. Question 5. What should the review of systems ROS focus on during patient interviews? A. Health conditions in the patient's family. B. Symptoms related to each body system. C. The patient's occupational history. Or D. The patient's insurance details. So it's review of systems or review for each system. So B. Symptoms. The answer would be B. Symptoms related to each body system, as review of systems or ROS involves systematically asking about symptoms in different body systems. And here we come to end of this lecture. Thank you very much and goodbye.